The issue of affordability is a serious one. Americans say the cost of health care is their biggest concern, and 1 out of 3 Americans say they put off needed care last year because of cost.
This is a complicated topic, how we move from a payment system that is based primarily on how much you do to one which is based on doing the right amount of care, putting on the front end the kinds of education and preventative services you can to keep communities healthy. And then you've got to create both at your board level and then within your management team this notion of why we're doing this. And in that regard, I frame it beyond being it's the right thing to do and it's how you and your families want to be treated.
AHA has launched the ValueInitiative to provide leadership to the healthcare field on this issue of affordability. The ValueInitiative will provide hospital and health system leaders with the education, resources, and tools they need to advance affordable healthcare and promote value within their communities.
Hospitals have an incredibly important role in terms of course, quality, but also improving affordability. And a lot of that comes through education and awareness, be sure people getting evidence-based, appropriate care at the right site, doing that care in a really high-quality way. And with that said, we also need to partner much more effectively with others in the community, whether it's the public health providers, whether it's community health centers, other non-medical community providers who can really help with reducing some of the disparities in healthcare, which are also critically important in terms of improving affordability.
For hospitals and physicians and health systems, we have a fundamental obligation, and I really do think it's an obligation to do everything within our power. That from the moment the patient, an individual becomes a patient and enters the healthcare system, throughout that experience, that those of us who are providing the care are working hard to figure out how to do that in as cost-effective a way as possible.
Already, a number of tools and resources have been developed to help hospitals and health systems improve affordability and promote value. Additionally, through the ValueInitiative, AHA has convened numerous educational opportunities, listening sessions, and discussions with expert panels. A chance to hear from colleagues across the country about the strategies they are employing to make care more affordable.
Understanding what affordable care is and how we define it means, I think, serving both as a convener and a catalyst for change. So part of what we're going to do is listen to others outside of our field, not just to innovations, but whether it's pharma or the insurance companies or local drugstores, what is it that we need to learn from others? So part of the committee's work, and I think part of what the field wants to do, is listen to others and serve as a convener of a lot of information, and then being very thoughtful about how do you pull those pieces together and come up with strategies to decrease the total cost of care while improving health outcomes.
The ValueInitiative will continue as a platform to foster dialogue among key stakeholders, policymakers, think tanks, and advocacy groups. Engagement by members, stories, data, and specific hospital experiences will inform and support AHA advocacy efforts and relevant policy solutions.
I'm also very happy with the forward-thinking and leaning-in approach that we're taking as the American Hospital Association in making this a top priority item that we are moving forward in a broader conversation now through the association.
Visit aha.org/the ValueInitiative to find out more about AHA's efforts and how you can get involved.